Hi, this is Dr. Marlin from Goldman Medical Center in Johannesburg again. We all know that feeling. You've just eaten your favorite meal, probably just had a little too much, and now your chest feels like it's on fire. You are even too scared to lay down. Heartburn, reflux, indigestion. We call it by a few different names, but we all mean the same thing. That burning pain in your chest, just under or just behind your breastbone. The pain is often worse after eating, especially in the evening, or when laying down, or even bending over can bring on that pain. But what exactly happens? What brings on this horrible sensation? Well, simply speaking, contents from the stomach, they back up upwards into your food pipe, otherwise known as the esophagus. And of course, with the stomach contents being very acidic, in an acidic environment, these acids then cause irritation in the esophagus, leading to what we would now commonly call heartburn. And then, of course, with today, with COVID-19, the lockdown, the lack of routine, extra trips to the kitchen, bypassing the fridge, poor eating habits, and then factor in a little bit of weight gain, and the scene is set for many of us to be battling with this worsening heartburn, the worst heartburn of our lives. Now, just remember that not everyone will present with that classic picture of burning chest pain. You may well experience some of the less commonly associated symptoms of acid reflux. And this can be a chronic, persistent, irritating, dry cough, even a sore throat. And sometimes some of you may complain of a bitter taste in the mouth, almost like a metallic taste of old blood in your mouth. Your voice may even become hoarse. And then sometimes someone may tell you that your breath may smell a bit foul, something that we call halitosis. Now, if you've been battling with this problem, what are some of the things that you can do to try and lessen the symptoms of the discomfort of heartburn? What can you do about your acid reflux and the problem of heartburn? And so here are Dr. Marlin's handy tips for heartburn. Number one, lose weight. If your heartburn is worse now than when lockdown started, you probably have gained a few kilograms. So start by losing some weight or doing something about your weight. And while we're talking about your weight, please don't wear those tight-fitting clothing, especially anything that's tight around the tummy. It's going to force some of the acid contents up and worsen your heartburn. Now, most of us battle with heartburn at night. So here are some important tips for the evening. Number one, eat dinner as early as possible. Please avoid those late night dinners. And then when you're eating dinner, eat a small dinner. Don't let dinner be the biggest meal of your day. And then when you are eating, eat your dinner slowly. Take your time. Don't gulp down your food. What about the type of food we're eating? Make sure that it's relatively bland. Avoid foods like mint, fried and fatty foods, spicy foods, tomatoes, onions, and garlic. All these foods can exacerbate or worsen any heartburn. Please don't exercise straight after dinner, especially exercises where you have to bend over and kind of push up those acid contents up into your food pipe. Now, once dinner is over, make sure that you stay upright, either sitting or standing. Please, no slouching after dinner, no napping on the couch, or no napping or falling asleep on the bed. And then make sure that there are at least 3 to 4 hours between dinner and between bedtime. And then, when you do get into bed, try and elevate the head of the bed using some pillows, or even better, get a brick or a block and put that under the head of your bed so that the head is slightly elevated. Need I say, no midnight snacks, no smoking. Good thing that we cannot smoke during lockdown. And then avoid any and all triggered drinks, alcohol, caffeinated coffee, tea, and your carbonated drinks. And then be careful. Look at your medicine cabinet. Be careful of any medications that can cause heartburn, especially your anti-inflammatory or painkiller medication. If you have a chance, see your doctor about medication to treat acid reflux. And while you're there, let your doctor check you out for any potential cardiovascular risk, such as the risk of getting a heart attack or stroke. And then lastly, again, lose weight. I hope this helps you get a better night's sleep, a sleep that is free of any heartburn. Thank you for watching. Goodbye.